If your cat suddenly vomits as frequently as in this video, accompanied by a sudden drop in appetite or a stiff arched back, contact a 24-hour emergency clinic immediately. This may be a sign of acute pancreatitis. When a cat suddenly vomits frequently and refuses to eat, many owners' first reaction is to suspect feline distemper. But there's a more insidious and deadly disease, acute pancreatitis. While feline distemper is usually accompanied by a high fever that may exceed 40 degrees, cats with pancreatitis tend to have a normal temperature, even cool to the touch. Pancreatitis can cause significant pain if the cat's abdomen is gently touched. They may arch their back and duck or purr, but distemper doesn't usually present with this kind of localized pressure. Differences in feces are also important. Diarrhea in feline distemper is often tinged with dark red blood and has a texture similar to diluted ketchup. Pancreatitis, although it is less likely to cause diarrhea, when it does occur, the feces tend to be grayish-white and oily film. The pancreas is an important organ located on the right side of the abdomen, adjacent to the stomach. It produces enzymes to aid in the digestion of food and hormones such as insulin that regulate the metabolism of blood sugar or glucose. When the pancreas becomes inflamed, the condition is called pancreatitis. A healthy pancreas is like an enzyme factory where digestive enzymes are normally produced in a dormant state. These enzymes are activated when they flow into the intestines through specialized tubes and begin to break down food. But in pancreatitis, these enzymes are awakened early in the factory, the equivalent of a bomb going off before it reaches its target. The result is that the pancreas begins to digest itself, triggering severe pain and inflammation. So, how do we diagnose a cat with pancreatitis? Adding a 15-minute test to the initial test can help you determine if pancreatitis is likely and allow you to provide answers to pet owners during the patient visit. The Helvet fPL fluorescent immunoassay detects pancreatic enzyme-specific lipase, and it is more accurate than amylase or lipase in diagnosing feline pancreatitis. Adding the fPL test to the initial examination of cats with these non-specific GI signs can help you determine if pancreatic inflammation is an underlying factor in your patient's disease. If the fPL test results are normal, pancreatitis can be temporarily listed as a low-priority differential diagnosis, and other diagnostic tests can be continued. If the results are abnormal, pancreatitis should be added to a higher differential list. Since the pathogenesis of feline pancreatitis has not been fully clarified, it is difficult to completely avoid the risk through preventive means. The fPL fluorescence immunoassay is easy to operate. It can produce results in 15 minutes, which on the one hand strives for the golden rescue time for critical causes of acute attack, and on the other hand can screen out early chronic pancreatitis when there are no symptoms such as vomiting, abdominal pain, to avoid the deterioration of the condition.